Did you know that some people believe that George Washington was not killed from a respiratory infection? There is speculation that he was killed from the shock of undergoing 4 bleedings in his last 24 hours. This practice is called bloodletting. It dates back over 3,000 years, and it reached its peak during the 18th and 19th century. Doctors at this time believed that the practice of controlled blood draining could cure and prevent all kinds of different diseases. According to the website, The Art of Manliness, the practice of bloodletting was even encouraged by the famous Greek physician Hippocrates. Modern medicine looks at bloodletting as quackery and says that it harms instead of heals. However, I learned in my research that there are some health benefits to this ancient practice. I'm here today to talk to you about the health benefits that the donor receives when they decide to give a blood donation. I am a blood donor myself. I first donated blood for the pure satisfaction of helping others. I started donating blood about 3 years ago after my husband was involved in a serious motorcycle accident. Over those first few days in ICU, I watched the nurses give my husband over 12 units of blood, and I felt so grateful that that blood was there to help them save his life. The Red Cross says that there is a need for a new blood donation every 2 seconds. They estimate that this adds up to about 44,000 blood donations that are needed each day here in the U.S. Most people who don't donate blood use excuses like, "I'm afraid of needles," or "I just don't have the time." In my research, I discovered 5 important positive health benefits to donors that they gain through regular blood donations. Blood donation preserves cardiovascular health. It reduces the risk of cancer and diabetes type 2. It burns calories, and it provides a mini physical. I thought if I went through these 5 benefits, it might encourage you to become a blood donor. Firstly, cardiovascular health is improved by regular donations as it eliminates excess iron from the body and helps to thin your blood. The Harvard Medical School Family Health Guide states that increased thickness and stickiness of blood is what increases a person's risk of heart disease. There was a study that was done and published in the American Journal of Epidemiology. They studied nearly 3,000 middle-aged men. The participants that had donated blood at least once per year had an 88% lower risk of heart attack than those who did not donate. There is a theory that women's monthly cycles help keep blood thickness and iron levels in check. This has been linked to the limited circulation problems that are experienced by premenopausal women. Unfortunately, men just don't have a way to get rid of this excess iron unless they regularly donate blood. The second reason, the benefit of donating blood, is that it decreases your risk of developing cancer. This is because the excess iron is linked to increased free radical damage, which causes cell mutations and higher rates of cancer. The Miller Keystone Blood Center claims that consistent blood donations are linked to lower risks of liver, lung, colon, and throat cancer. Thirdly, people that have excessive iron in their bloodstream have a decrease in their insulin sensitivity. This gives them an increase in developing type 2 diabetes. Studies have shown that regular blood donations can help you stay lean, and it reduces your risk of developing diabetes. Fourthly, donating blood burns calories. The Red Cross found that you burn 650 calories every time you donate a pint of blood. Of course, they don't recommend blood donation as a safe weight loss program. They actually have rules where all donors must weigh at least 110 pounds and they have to have healthy blood iron levels. This brings me to my 5th and final health benefit that you can gain from being a blood donor. Every time you donate blood, the nurse is required to give you a mini physical. This means that they check your pulse, your blood pressure, and they also check your blood to see if your iron level is adequate or if you are suffering from anemia. In addition, all the blood that is given is tested for a multitude of infectious diseases like HIV or hepatitis C. This mini physical gives the patient a chance to discover preventable health problems before they become any more serious. I've outlined all the health benefits that you get from becoming a blood donor. I'm sure that you want to become one now. As you leave this room today, please take the time to write your name and contact phone number down on the sign-in sheet at the back of the room. I will pass this list on to the Red Cross so that they can contact you personally. When you think of blood donation in the future, I hope that you remember all of these health benefits. Even though most people think of blood donation as a selfless act of charity, it can also be looked at as a selfish act that improves one's own health. Thank you.